Hello, Kauai. This is your County of Kauai briefing for Thursday, September 9th. The Delta variant continues to spread widely in our community. A majority of our recent cases are residents who are close contacts of previously announced cases or known active clusters. Yesterday, the Kauai District Health Office announced 33 new cases, all residents. 8 are children and 25 are adults. Today we are announcing 55 new cases, 1 visitor and 54 residents. 12 are children and 43 are adults. 47 of the cases are considered community acquired and 8 are related to travel, including 2 individuals who did not receive their positive test results until after their arrival on Kauai. 3 of today's cases have not responded to or refused to provide information to the Department of Health's contact tracers, which endangers our community. We now have 317 active cases on Kauai. Most are isolating at home. 8 of them are in our isolation facility, and 4 are currently hospitalized. We've confirmed a total of 1,763 cases since the start of the pandemic, with 9 fatalities. At this time, Kauai County does not have a vaccine verification requirement to enter businesses such as restaurants. Mask and group size requirements continue to be enforced. Per the governor's order, organizers of events larger than 50 people must submit their plans to the county at least 10 days in advance, online at kauai.gov/COVID-19. Last week, we issued an emergency rule that established fines for violating the state of Hawaii's COVID safety rules. The order mandates fines of $250 for individuals and $500 for businesses and organizers who violate COVID-19 rules, such as mask wearing, gathering and capacity limits, and event requirements. This allows law enforcement officers to issue fines on the spot and more efficiently enforce the rules. For more information, visit kauai.gov/COVID-19. Let's review the top 6 COVID-19 recommendations. Don't travel unless absolutely necessary, and if you must travel, get vaccinated first and take a free post-travel test 3 to 5 days after you return to Kauai. Don't gather. Please postpone your event until it's safer to do so, and if you do gather, stay outdoors. Do wear a mask when around others. Do stay home when you are sick. Get vaccinated if you can. A vast majority of the people who are becoming hospitalized are unvaccinated. We continue to offer free testing to anyone on Kauai. We now have a ticketing system at the convention hall, so you don't have to wait around. Beginning at 8 a.m. each weekday, we will hand out free tickets, first come, first served. The tickets will show a specific time for you to return to your test later that day. Advance appointments for free tests are available now at the Lihue Pharmacy. These tests are paid for by the Department of Health with no cost to you. Make an appointment by visiting preventcovidhi.com and selecting Kauai. They also accept walk-ins 7 days a week from 9 a.m. to 5 p.m. on Kolopa Street by State Farm. Walk-ins are welcome at our free mobile testing van. You can find the mobile testing van in Kekaha on Wednesday, Kilauea on Thursday, Kalaheo on Friday, Hanalei on Saturday, and Kapa'a on Sunday. It is open from 9 to 1 each day. No appointments are needed, and results are provided the same day. If you have insurance, save time by scheduling a test at one of the drive-through options like Wilcox Medical Center, KVMH, or Clinical Labs. For more information, visit kauai.gov/COVID test. If you test positive, don't wait for the Department of Health to call you. Isolate yourself immediately and notify people who are near you during the past 14 days. When the contact tracers call you, please get back to them right away so we can slow the spread of the disease. Help them help us. They are serving our community and they deserve our respect. Now it's time for Ask Dr. B, where our Kauai District Health Officer answers your questions from Facebook. Dr. B, with the majority of people now vaccinated, what is causing the surge in cases?
Thanks, Mayor. Kauai is experiencing widespread community transmission due to the Delta variant. The CDC reports that the Delta variant is more than twice as contagious as the original COVID-19 strain. That means that one infected person can spread the disease more easily to more people. Our surge in cases is the result of this rapid spread. The Delta variant was first identified in Hawaii just 3 months ago in June. Now it's responsible for nearly every case of COVID-19 statewide, including on Kauai. Delta is spreading through our community. It is highly transmissible, and it can be spread by individuals who are only mildly sick or don't feel sick at all. These people may not know they have COVID-19 infection, but they can spread it to others. Vaccination is the best way to prevent severe disease, hospitalizations, and death. Vaccines greatly reduce, but do not completely eliminate, the risk of becoming infected and spreading COVID-19 to others. Everyone should take precautions to prevent COVID-19, including masking in indoor public places, whether or not you are vaccinated.
Dr. B, how many of our cases are in people who are unvaccinated?
The State Department of Health has identified 2,400 breakthrough cases in fully vaccinated individuals since the vaccines became available. That's about 7% of all people infected. While vaccinated people can get Delta and spread it, they are much less likely to do so than unvaccinated people. The key takeaway is this: the vast majority of those getting sick, hospitalized, and dying from COVID are those who have not received a vaccine. Getting vaccinated is a lot like wearing your seatbelt in a car. It's not a 100% guarantee that you won't be injured, but you're a lot safer with it than without it.
Dr. B, what is the Mu variant, and should we be concerned?
The Mu variant is in the news, but it is not a large concern for us right now. It was detected in a small number of samples several weeks ago in our state and has not been detected since. Although public health officials are monitoring this variant, there has not been any evidence that this variant is one that is likely to become dominant in the way Delta variant has. The thing to keep in mind is all viruses, such as COVID-19, evolve over time, and most variants do not become concerns. Countries around the world continue to focus on the Delta variant, which is the dominant variant in most places now. The faster vaccines become available to populations around the world, the less likely it will be that new concerning variants will form.
Last question for today. There seems to be a lot of misinformation about ivermectin, both being used as preventative and an alternative cure to COVID-19. Can you please address this?
It's understandable that people are interested in a medication to treat or prevent COVID-19, especially one that's relatively inexpensive and readily available. Unfortunately, we do not yet have such medications. We do have vaccines that prevent severe disease and monoclonal antibody treatments that can help even after you've been exposed or infected. Specifically, many people are talking about a drug called ivermectin. This is a useful drug for the right kind of infection. Worms and head lice are examples. But COVID-19 is not one of those infections. There was some hope early on and some preliminary evidence that this drug might be effective against COVID-19. But continued study has demonstrated clearly that ivermectin has no effect on COVID-19. In addition to not being effective, ivermectin can have significant adverse side effects, especially when given in large doses over long periods of time or when taken without coordination with a healthcare professional. Increased use of ivermectin for COVID-19 has resulted in a large surge in calls to poison control centers regarding people, including young children, being poisoned by this powerful drug. If you're looking for a safe, free, and effective way to prevent COVID-19, vaccination is the way to go.
Mahalo, Dr. B, and thanks to all of you who are vaccinated. 69% of all Kauai residents have now gotten their first dose, and 63% are fully vaccinated. When you calculate it without those under 12 years old, that means 81% of those who are eligible have gotten at least one dose. Everyone aged 12 and older can get a vaccine, and they are available 7 days a week across the island. To find out where you can get a vaccine, visit kauai.gov/vaccine. Businesses, organizations, and individuals can also request the Department of Health's mobile van to offer free vaccines to adults at community gatherings and functions. Sign up at kauai.gov/vaccine. Mahalo, Kauai.